Basically, everything I do is because I'm bored and I need new challenges and new stimuli. Hi, I'm Elad Jacoby. During med school and after, I fell in love with pediatric oncology. This is treating children with cancer, and it's a true opportunity to make an impact, a change in someone's life. Also, it combines state-of-the-art science in daily practice. About 10 years ago, I studied a new form of therapy called CAR T cells. I love taking things from the idea, the concept in the lab, and finding the ways to put them in the process to take them to patients, to translate what we see in the lab in the science to patient care. This requires looking at the big picture and working in interdisciplinary teams with people from the lab, clinicians, nurses, social workers, and much more. And today, I invite you to my talk called Tea Time.
Please welcome to the stage, Dr. Elad Jacoby.
One of the worst moments for a parent is when he or she hears that their child has cancer. And even worse, when the cancer has come back when previous therapies have failed. I'm a pediatric hemato-oncologist, and I treat children with cancer, mostly leukemia, a cancer of the blood or marrow. Now, leukemia was a deadly disease in the 1950s, but I want to tell you that with modern therapy, most children are cured. However, for a disease that unfortunately returns, we want and we need to do better. In recent years, a new form of therapy was introduced to the world of cancer, immunotherapy. You may have heard of it, with a Nobel Prize recently awarded to two scientists who managed to enhance the body's immune response against cancer. But for childhood leukemia, this form of passive enhancement was just insufficient. A decade ago or so, when I started my training in the National Cancer Institute in Maryland, a new form of therapy was implemented using T cells. These are the most powerful cells of our immune system that usually fight infections. For treating leukemia, we needed to re-educate these T cells actively and help them target the disease. We learned how to take this powerful immune soldier that knows from years of evolution to fight viruses, bacteria, and more, and target it towards leukemia. This is like adding targeted missiles to the patient's own immune cells through genetic engineering, teaching them to attack specific cells and sending it to destroy malignant leukemia cells. Surprisingly, this worked. We were astonished to see patients that had failed many therapies suddenly have all their disease cleared only with this immune manipulation. So we had to rapidly implement this therapy in Israel. Now, this was not a simple task. It was quite a challenge. We're not talking about a drug you can pick off the shelf from your pharmacy. This is a personalized therapy. We had to learn how to collect the immune cells from the patient, take them through heavy manipulation in the lab, and administer them back to the patient. For this, we needed lab technical state-of-the-art knowledge. No one in the country knew the process in which T cells are re-engineered or re-educated. We needed clean rooms in which we can safely work on cells, making sure that they're not contaminated through this long process. We needed clinical training for pediatricians, hematologists, nurses, ICU teams, and more to introduce them to these new therapies and their potential risks and benefit. And we needed regulatory approval of this high-tech interventional therapy to make sure that we can actually grow T cells outside the body and safely transfer them back to patients. Sheba was one of the first institutions worldwide to deliver locally produced CAR T therapy to patients. This is thanks to excellent people and fast adaptation of staff and infrastructures. So now we had a new tool for leukemia when all previous therapies have failed. We treated the first patient, a child under my care, back in 2016. This child is now 6 years later and doing well. And we have since treated more than 200 patients, children and adults. Let's take this one step further and see where we're aiming at. Sometimes leukemia resides in the brain. It hides them from all the therapies that we give. You can see it here. The bright rectangular shape on this brain image is actually a leukemic mass. Early on, we assumed that T cells, as they can go into the brain to treat infections, may go there also to treat cancer, only if we help them a little bit. So we took upon ourselves to treat children with leukemia in the brain. And we could indeed see that these novel cells cleared disease that resided there. In the future, we want to be able to provide therapies using re-educated T cells for more diseases. We want to target brain tumors in children, as these are extremely difficult to treat. After proving that re-educated T cells can kill cancer cells and they can enter the brain, we are in the process of finding the right targets in these tumors. After all, this is T time. Thank you.